My name is Jayme. I'm a dentist and I live in Virginia Beach, Virginia with my wife and son. I was diagnosed with IgAN or IgA nephropathy in 2005. I noticed that my urine was dark and foamy. I looked for medical advice and I was referred to a nephrologist, and a kidney biopsy was done and diagnosis was made that I had IgA nephropathy or IgAN at that time. My nephrologist said that damage was already done to the kidneys. When I got the diagnosis, I already had lost 25% of my kidney function. There was not a lot of research in this disease. There was not a medication properly designed to treat it. We just were treating the symptoms of the disease, and my nephrologist had prescribed high dose of steroids, and the side effects were difficult to handle. And we did that for a couple of years because we were trying to see what was working and what was not. I was hopeful to hear about a treatment option that might be right for me. And then my nephrologist mentioned that there was TARPEYO. When determining if TARPEYO was right for me, I had a lot of open conversations with my nephrologist. I wanted to understand how my experience might be different from other steroids I had tried in the past. My nephrologist explained to me that, unlike my previous medications, TARPEYO is a 9-month treatment and is specifically designed for IgAN by targeting the gut. I took TARPEYO 4 capsules a day in the morning before going to work. The TARPEYO Touchpoints team has been assisting me since I first started taking TARPEYO. My nephrologist filled out an enrollment form, and the Touchpoints team reached out to me and assisted me with refills every month. I couldn't be happier knowing that my TARPEYO treatment was fully covered with zero copay. Within just a few weeks, TARPEYO was delivered straight to my front door. It's been a seamless experience from start to finish. I wanted to share my experience with others who are maybe hesitant to start treatment because of their past experiences. It takes some months for you to start seeing some results on the lab. Just months after I started taking the medication, we did a new lab work and my labs were really good. They'd never been like that good for years, so I was very excited. We saw a marked improvement on my GFR numbers and improving my renal function. The medication was really working the way that's supposed to. We finally are able to have more control over this disease that I've been battling for so long. After taking TARPEYO for 9 months, I feel like my IgAN is in my hands.
Important safety information. Do not take TARPEYO if you are allergic to budesonide or any of the ingredients in TARPEYO. See the end of the patient information for a complete list of ingredients in TARPEYO. Before taking TARPEYO, tell your healthcare provider about all of your medical conditions, including if you have liver problems, plan to have surgery, have chickenpox or measles, or have recently been near anyone with chickenpox or measles, have an infection, have high blood sugar levels, prediabetes or diabetes, have glaucoma or cataracts, have a family history of diabetes or glaucoma, have or have had tuberculosis, have high blood pressure, hypertension, have decreased bone mineral density, osteoporosis, have stomach ulcers, are pregnant or plan to become pregnant. TARPEYO may harm your unborn baby. Talk to your healthcare provider about the possible risk to your unborn baby if you take TARPEYO when you are pregnant. Are breastfeeding or plan to breastfeed. It is not known if TARPEYO passes into your breast milk or if it will affect your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with TARPEYO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. TARPEYO and other medicines may affect each other, causing side effects. How should I take TARPEYO? Take TARPEYO exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take TARPEYO. Do not stop taking TARPEYO without first talking with your healthcare provider. Take your prescribed dose of TARPEYO 1 time each day in the morning, at least 1 hour before a meal. Swallow TARPEYO capsules whole. Do not open, chew, crush, or break TARPEYO capsules before swallowing. If you miss a dose of TARPEYO, take your prescribed dose at your next scheduled time. Do not take 2 doses of TARPEYO at the same time. If you take too much TARPEYO, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking TARPEYO? Do not eat grapefruit or drink grapefruit juice during your treatment with TARPEYO. Eating grapefruit or drinking grapefruit juice can increase the level of TARPEYO in your blood. What are the possible side effects of TARPEYO? TARPEYO may cause serious side effects, including effects of having too much corticosteroid medicine in your blood, hypercorticism. Long-time use of TARPEYO can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercorticism: acne, bruise easily, rounding of your face, moon face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, buffalo hump, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. Adrenal suppression. When TARPEYO is taken for a long period of time, chronic use, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with TARPEYO. Risk of immunosuppression. TARPEYO weakens your immune system. Taking medicines that weaken your immune system makes you more likely to get infections. Avoid contact with people who have contagious diseases such as chickenpox or measles during treatment with TARPEYO. Tell your healthcare provider right away if you come in contact with anyone who has chickenpox or measles. Consult with your healthcare provider regarding appropriate vaccination scheduling. Tell your healthcare provider if you develop any symptoms of infection during treatment with TARPEYO, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of TARPEYO include swelling of the lower legs, ankles, and feet, high blood pressure, muscle spasms, acne, headache, upper respiratory tract infection, swelling of the face, weight increase, indigestion, irritation or inflammation of the skin, joint pain, increased white blood cell count. These are not all the possible side effects of TARPEYO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.